We can confirm that we are expecting to receive 2 patients with cancer from Ukraine within the next 24 to 36 hours. Although we have the capacity to take more children, we are also collaborating with other Canadian children's hospitals who have offered capacity. This is a highly fluid situation that changes sometimes on an hourly basis. And while we are in very active conversations with our medical colleagues in Poland on a daily basis, we cannot confirm at this moment whether more pediatric patients will arrive for care in Toronto. And we are fortunate through these collaborations to be in a position to be able to continue supporting our Ukrainian partners throughout these incredibly difficult times. And we will be there for the children and families who need us while ensuring there are no impacts to patient care for Torontonian, Ontarian, and/or Canadian children. This is maybe one of the most complex logistical challenges that we have faced so far here at SickKids. As you can imagine, you have to, on one hand, identify patients and families who are able to travel to Toronto. At the same time, in parallel, you have to ensure that we have a transport mechanism for these patients from Poland to an airport to Toronto. And we have to have immigration papers in hand in order for the families to enter Canada. On top of this, we had to make sure that we work with our community partners, and I will have to say that the support from our Ukrainian communities and other communities has been unbelievable to ensure that once the families are here, that in addition to the medical care that we provide here at SickKids, we have opportunities to provide support for families within the community. So I hope this gives you a little bit of an idea of how many different challenges we have to manage almost in parallel. And all of this happens in the context of many, many patients and families crossing the border from Ukraine into Poland, having to be assessed by our colleagues on the ground in terms of their diagnosis, in terms of the ability to go on a longer flight, and also taking into considerations some of these medical aspects. Medical documents have to be translated. So I probably could go on for a little bit longer, but I hope that gives you a flavor of the complexity of what we had to manage. But we were working so well together with so many of our partners, including the federal and provincial government, that we were able to organize the first trip.